Diabetes. I'm sure you know someone who has it, or maybe you have it yourself. Type 2 alone has affected approximately 35 million people in the U.S.
Diabetes is an extremely common disease, and really what it is a disease of sugar or glucose handling in the body. Type 2 diabetes is what we call adult onset diabetes. It is much more common than type 1, and it's a disease where instead of not having enough insulin, which affects your glucose or sugar level, what happens is the body doesn't respond to insulin as well.
The risk of diabetes increases with age, especially over 40. Smoking, being sedentary, having a poor diet, and being overweight increases your risk.
However, one of the greatest factors is a genetic issue. So if you're unlucky enough to have a parent who has type 2 diabetes mellitus or a sibling that has type 2 diabetes mellitus, this is probably really the strongest link that you may develop this as well. Sometimes that diabetics or pre-diabetics have no symptoms at all. So that's really where an A1C can come in.
An A1C test simply shows the average of your blood sugar over the course of 2 to 3 months. Diabetes keeps your sugar levels consistently high, which can affect vision, kidneys, and of course, the heart.
Diabetes can lead to a cardiomyopathy, and that's just a fancy word for saying that it can lead to your heart becoming weaker. But the thing that we see the most is it really interferes with the normal action or mechanism of the arteries. And with increased blood sugars come increased inflammation, plaquing.
All of this will make the person more susceptible to having a heart attack, and that's exactly why people with diabetes are more at risk of developing heart problems.
The number one thing is to get really good control of the blood sugar in the body. We really made some great strides, and the better, tighter blood glucose control we can get, the less likely that we're going to develop cardiac complications, and hopefully the patients live longer and longer and have great lives.
There's no major cure for diabetes, but staying vigilant about your blood sugar and understanding your risk factors can make the condition very manageable and ultimately help you live a longer, healthier life. Ed Russo, CBS 21 News.